You now have a basic understanding of firearm injury epidemiology in children, as well as safe storage options for firearms. Combined with your existing basic counseling skills as a pediatrician, you have the ability to provide specific firearm safety counseling to patients and families in the clinical setting, ensuring the safety of children in your community and beyond. In the following module, we provide 3 examples of firearm safety counseling by a pediatrician in a variety of realistic situations that you may encounter. The objectives of this module are as follows: to recognize how to screen for guns and gun storage in the home through direct questioning, to identify children and adolescents at risk of firearm injury in the clinical setting, to develop non-threatening and developmentally appropriate counseling techniques around firearm injury prevention, to recognize the barriers and challenges in providing firearm injury prevention counseling, to develop skills to approach challenging physician-parent or caregiver interactions, and to develop the ability to refer patients to available resources according to risk factors identified. Before we launch into the scenarios, below is a reminder of basic counseling tips that you can apply to firearm safety discussions with your patients and their families. Always ask for permission prior to opening a topic for discussion. During your discussions, create a safe space for open discussion and questioning. For a better understanding of your patient's views and circumstances, ask open-ended questions. Explore the knowledge, experiences, and motivation of your patients and families to help guide where your conversation should go. During your conversation, show nonverbal cues to show understanding, and summarize or paraphrase your patient's comments to ensure your own understanding. Lastly, incorporate your patient's contributions into discussions about options and decision-making moving forward. If your patient or family member is not ready to have a conversation about firearm safety, don't force it, but do encourage them to revisit the topic when ready. If you plan to share information or educational materials, always ask for permission prior to doing so, and try to tailor that information to your patient's experiences and circumstances. Acknowledge the patient or guardian as the expert in his or her life. Affirm positive behaviors and thinking. And lastly, always remain respectful of your patient's views, even if they differ from your own. In the first scenario, we meet James, a 15-year-old boy who has been sent to the emergency department for suicidal ideation and depression. He told his school counselor that day that he was, quote, seriously thinking about ending it all. He does not have a specific plan to carry out any actions. At this point in the encounter, you have already discussed medications and counseling, and you are now developing a safety plan for James.
Hi James, I'm Dr. Shel Pfeffer. It's nice to meet ya. So I hear you've been feeling a bit down lately and have had some thoughts of harming yourself. I've had other teenagers come into my office and tell me they feel this way from time to time. I want to hear more from you about how you've been feeling and the thoughts you've been having. Then we can work together to come up with a plan to make sure you stay as safe as possible. Does that sound okay?
Okay.
Okay. So when was the last time you had thoughts of hurting or killing yourself?
I don't know. Probably this week. I don't think I'd actually do it though.
Okay. And why don't you think you would do it?
I don't know. My family, I guess. My family's really important to me. Especially my little brothers. I wouldn't want to put them through that.
Yeah, I can tell you really care about your mom and your dad and your little brothers. You wouldn't want them to go through that. So when you're having these thoughts, have you ever had a plan of how you would hurt yourself?
No, I don't think I haven't gotten that far yet, I think.
Okay. So I'm going to ask you some questions that I ask everybody, okay?
Okay.
All right. So do you or your family have any guns in the home?
Yeah, my dad keeps some for hunting.
Okay. Do you know where he keeps them?
Yeah, they're down in the basement.
Okay. Are there any other guns in your home?
No, just the ones in the basement.
Okay. So I'd like to bring your dad back in so we can talk about this some more, okay?
Okay.
Okay. Hi, are you Dad?
Yeah.
Hi, I'm Dr. Shelfeffer.
Nice to meet you,
Nice
Doctor.
to meet you. So I've been talking with James about how he's been feeling down and having some suicidal thoughts lately, and we want to make sure that we have a plan together to keep him safe and that your family is comfortable with.
Yeah, thank you so much for talking with him about this. His mom and I have been really worried about him.
Yeah, I think it's great that you're here to discuss this difficult topic and support James. He told me that your family has some guns used for hunting in the home. How are they being stored right now?
Yeah, we've got 2 hunting rifles that we keep in the basement.
Okay.
The boys come hunting with me like every year. They've been through all the training, all the safety, and we keep them in the basement, locked up in a case, and I hide away the key.
Okay. All right. So it's great that you've taught your kids how to be safe with guns, and it's also really great that you're storing them safely. Would it be okay if I shared a little bit more information with you?
Sure.
Okay. So we've actually found that parents are usually surprised to know that most kids know where their hiding spot is for keys, and that can be their keys to the guns or to their liquor, even if you've never told them or shown them before. We've actually found that finding a new hiding spot is not really effective either. I know you care a lot about James and want to do what's best for his safety.
I do.
So while James is feeling this way, is there a family or a friend's house you could securely store your hunting rifles?
I mean, I can look into it, but it seems awfully extreme.
So I know it sounds extreme, but after talking to your son, my gut and my training are telling me that we need to do everything to keep him as safe as possible. Removing the guns from your home would be the most important first step. I will also refer him to some counselors, and we should start talking about medication. Does that sound okay?
That sounds good. That
Okay.
sounds safe.
In the next scenario, Dr. Shelfeffer provides anticipatory guidance, including general safety counseling, to the mother of Sarah, a 6-year-old girl seen in clinic for a well child exam. Sarah's family does not keep guns in the home, but guns may be present in areas or homes where she plays.
So as a part of our visit today, I'd like to talk about ways to help keep Sarah safe at home. So things we're going to talk about include helmet safety and firearm safety. So when you think about Sarah riding her bike or her scooter, how often would you say she wears her helmet?
Sarah's not really riding a bike yet. She hasn't been that interested, but certainly when she starts to become more interested and we're out practicing, I will definitely make sure she's wearing a helmet.
Excellent. So obviously you understand how important it is to protect her head, and
Absolutely.
we'll make sure she wears a helmet every time she rides her bike.
Yeah.
Okay, great. So the next safety issue I want to discuss is guns. Do you have any guns in your home?
No, my husband and I don't have any.
When Sarah goes to other houses, do you ever ask if there are guns in the home?
You know, up until this point, Sarah has really only played at the homes of my family or friends of my husband and mine, and I know who has guns at home, and they all keep their guns in those gun safes, so I haven't really been that worried. But as I think about it, she's starting to make more friends at school, which is
Yeah.
great, and more people are starting to invite her over to their homes, and I don't know those parents as well, so I haven't, to be honest, I haven't asked them if they have guns at home. I think I feel a little embarrassed to do so, and I don't want to create any awkward situations or feel like, that I'm accusing them of something.
Yeah. So it's understandable how it would be a bit uncomfortable to ask people you barely know about guns. We do know it's important to ask because children often have easy access to guns in the home, and easy access to guns can lead to children accidentally shooting themselves or someone else. So would you mind if I talk to you a little bit more about what other parents have done in order to ask other families about whether or not they have guns in their
Yeah,
home?
please do. That would be really helpful.
Yeah, so what other parents have found is that flat out asking, are there guns in the home or will there be guns where Sarah is playing, is the most effective way to go about it. If they answer yes, then you can talk about the importance of making sure that guns are stored securely, meaning that they are unloaded with locks and all ammunition is locked in a separate location.
Okay.
How does that sound?
I think I can do that.
Great. So I know Sarah's safety is really important to you, and if you're ever in doubt of a place where she'd be at, just invite the kids over to your house. That way you can feel comfortable and you know that she's safe from any guns in the home.
Yeah, that's a great idea. I'll definitely
Great.
keep that in the back of my mind.
All right, yeah, so before you leave, I'm going to give you a handout that goes over some more of this information. So you can even share the handout with your husband or other parents, friends' parents.
Yeah.
And if you go to the Ask Campaign's website, Ask stands for Asking Saves Kids, you'll find more resources to
Great.
review.
Okay, thank you so much, Dr. Shelfeffer.
Yeah, no problem.
In the final scenario, Dr. Shelfuffer provides anticipatory guidance, including general safety counseling, to the father of Mark, a 3-year-old boy seen in clinic for a well child exam. Mark's parents do have guns in the home and currently do not store them safely.
So as part of the well child check today, we're going to talk about some safety issues such as properly wearing helmets and properly storing firearms. So are there any firearms in your home?
Yeah, we've got 2 hunting rifles in the home. We use like only during deer season. Other times we just keep it out of the way of the kids and stuff.
Okay, great. So can you tell me how they're stored and where they're located right now?
Yeah, I mean, right now it's just like right behind the couch because, I mean, Mark's only 3, so small. He can't move the couch. It's pretty safe back there. And I mean, even if you were to get to him, he can't pull the trigger or anything like that yet. And I mean, and if he gets into anything that he shouldn't be getting into, we tell him like no, like pretty firmly, and he listens pretty well, I think.
All right, so right now the guns are kept behind the couch and they don't have any locks on them. Is that correct?
Yeah, I mean, I don't see why we need to keep them locked or anything.
Okay. So would you mind if I shared a little bit of information with you about guns and toddlers Mark's age?
I guess.
Surprisingly, research has shown that children as young as 3 are strong enough to pull the trigger on most guns. I know you want to do what's best for Mark here, and I know how curious little ones can get as they grow up, even when you tell them not to touch something. What are your thoughts on getting locks for your guns?
I mean, I don't see the point in spending money on something I don't need.
Yeah, it's difficult to imagine that children as young as 3 are strong enough to pull the trigger and that puts them at risk for serious harm and injury from unlocked firearms. While I understand you don't see gun locks as necessary at this time, locks really are the best way to prevent accidents. And having an unlocked gun in your home makes me nervous for Mark's safety. The other option would be to disassemble the gun so that it doesn't have a chance to fire. But the most important thing is that the guns be kept unloaded at all times so Mark never has a chance of accidentally shooting himself or someone else. How does that sound to you?
I mean, we already keep the guns unloaded as it is, so, I mean, keeping them separated and locking other stuff up, I mean, that sounds pretty easy. I guess I could do that.
Yeah, that's great. So the best prevention of injury would be to store your guns with a lock in place, as well as locking up the ammunition separately from the gun itself, such as in an ammo box. I'm going to give you a handout here today before you leave in case you change your mind or want to learn more about the different gun locks and how they work. And one last thing I should mention is that most police departments offer free cable gun locks to anyone who wants them.
Free? I didn't know that. That's new information for me, so I can look into that, I guess, especially if it's free.
Excellent. So I think it's really great you're keeping yourself open to thinking about additional ways you can keep Mark safe. I'm going to give you this handout on firearm safety that you can take home with you. And I want to thank you for talking about all this with me today.
Thank you so much, Doctor. I appreciate it.
Yeah, no problem.
So how do you handle a situation in which a patient or family member is not interested in or not ready to have a discussion about firearm safety? If you find yourself in this circumstance, again, don't force the conversation, and don't argue or dismiss the patient's stance on the subject. Instead, acknowledge his or her ideas, and show your patient that you respect that he or she is the expert in his or her own life. Here are a couple examples of responses. Number 1. I respect that you don't want to discuss this with me today. You know your situation and circumstances best. When you leave today, if you'd like, I'll give you a flyer that we give to everyone on safe gun storage. What you decide to do with this information is your choice. Number 2, I understand that at this time, this isn't a concern for you and your family. If in the future you or your spouse would like to learn more about gun storage, we offer a flyer to everyone that you can take home with you if you'd like. We leave you with a summary of basic counseling tips presented at the beginning of this module to have at your disposal for future patient interactions.